Your medical gap cover is not a medical aid or medical scheme, but an insurance policy that covers all dependents on the main member's medical scheme, with the exception of multiple spouses. Medical schemes set the amount that they will pay for each and every treatment they will cover. This is known as the Medical Scheme Tariff or MST. Your medical scheme will pay 100%, 150% or even 200% of the medical scheme tariff, depending on the option you are on. When being treated, however, surgeons, anaesthetists and other medical specialists are free to charge whatever they like.
With the result being that they frequently do and substantially more than the MST. Your universal gap cover policy takes care of this unpaid shortfall.
Let's look at a quick example to better illustrate this point. Michelle is hospitalized for a routine appendix operation. The procedure is performed without complications and she's in and out of hospital in 2 days. A week later, she receives the bill. She's not expecting any surprises as she's on a medical option that pays 100%. This is Michelle's problem. While a medical aid scheme will pay 100% of their predetermined tariff, her doctor charges a completely different rate. She opens the bill, which reads, General Surgeon's fees, R10,200.38. Anaesthetist, R7,544. Total charge, R17,744.38. Medical scheme tariff at 100%, R7,247.75. Unpaid, R10,496.63. Michelle now needs to find the additional R10,496.63 to settle the anaesthetist and surgeon.
Your universal gap cover policy takes care of this unpaid shortfall.
This is the unpaid amount that your universal gap policy covers. Once you put in your claim, we will pay the shortfall up to 5 times the MST, to a total maximum of R250,000 per individual and R2.5 million per family per year. Your gap policy also covers what are called co-payments. These are amounts charged by the medical scheme that require upfront payment to access certain facilities and treatments. Medical schemes use these co-payments in a similar way as car insurers use excess payment charges to discourage unnecessary or overly frequent claims against the medical scheme by their members. The typical co-payments charged by medical schemes are R1,000 to R1,500 for hospital admissions and R1,500 to R2,500 for procedures like MRI or CT scans. Your gap policy covers in-hospital co-payments to a total annual limit of R20,000 per year.
In order to qualify for the gap cover, the procedure that results in the shortfall must be approved and covered by your medical scheme. Universal gap cover only pays for the shortfall on doctors and specialist charges, not on ward fees, medicines or prosthesis.
Your gap policy typically only covers procedures that take place as in-hospital procedures, but there are approximately 50 out-of-hospital procedures that are covered as well, and these are listed in your policy document.